we go further, hope you have watched the video Who Can Be a Public Mental Health Champion. If not, please watch it by clicking on the icon. I am sure now you understand the fact that mental health is a public health issue. This means routine clinical care and management of mentally ill are important, but for anyone to address the core and deeper issues, they need to incorporate a public health approach into any mental health initiative. It does not matter who is watching this video. Anyone watching can play a positive role in public mental health. This can be substantiated by the fact that public mental health is influenced by 1. Mental health initiatives. For example, the district mental health program has been able to take professional mental health care to larger communities and beyond cities. 2. Health initiatives in other areas can emphasize or contribute to public mental health. For example, prenatal checkup and counseling could make positive strides in women's psychological well-being. Non-health initiatives can influence public mental health. For example, regulated financial loans and incentives to farmers could reduce the economic burden on them, or education for all could empower children to learn and address adversities better. 4. Mental health being a complex interplay of various domains and factors, public mental health too demands interdisciplinary linkage, collaboration and execution. Looking at mental health through the lens of public health, a public mental health approach should conform to all these aspects: respecting human rights, taking up evidence-based practices, striving for universal mental health coverage, taking a life course approach. Elucidating the public mental health approach further, let us consider the service seeker and provider at two extremes. Taking a public health approach could mean working on any of the following, like early identification and treatment, reducing premature mortality, empowering people and family, using technology to increase access, diversifying mental health force, engaging a multidisciplinary team. Basically, the need of the hour is a comprehensive and integrated approach. Two key areas one can work are decentralizing the point of care, and the second one is taking up a humane approach. Let us look at each of them. Decentralizing the point of care could benefit in multiple ways. Empowering the grassroots workers with knowledge about identification of mental health problems, need for long-term care and follow-up, they could bring about positive change by early identification, ensuring better treatment and compliance, which remain a cornerstone of long-term recovery. Developing step-up approach of professional care could help the overall efficiency of service provided. Intensity and nature of problem one suffers could determine the need for a particular level of professional care. This shall ensure that the system is not clogged by a number of seekers, which might lead to most deserving patients being kept out of the system or service provided. Mental health services are marred by lack of enough trained professionals, hence training the existing system. Developing a guided self-care platform could help at least those who suffer less severe forms of mental illness. The two important outcomes looked at while decentralizing the point of care are: 1. Increasing the capacity of non-specialists and specialists in their ability to provide mental health care. 2. Instead of reinventing the wheels, connecting the existing dots. Taking a humane approach is quintessential. Ensure that the rights of the individuals are respected. They are empowered at every step. Work on reducing exclusion and enhancing inclusion. Stop chaining. It is also important to note that breaking the invisible chains in the form of stigma and lack of awareness are bigger challenges. After all this information, you might be wondering who will bell the cat. Is it the service users and families, mental health professionals, government, media, international organizations, businesses and employers, researchers? The answer is anyone with intent. It is agreed that government, political will, and policymakers play a major role. But change begins with you. You can be an initiator, eye-opener, snowballer, implementer, or a partner and influence public mental health positively. One of the crucial factors behind successful implementation of any scale of public mental health program remains the funding. There are multiple reasons to invest in mental health. Some of them are: put useful knowledge to practice, promote rights and inclusion, reduce negative impact, prevent premature death, reduce economic burden. While investing, it is mandatory to look into the effectiveness of the public health intervention for determining the funding strategy. You might be an individual or representing an organization. Can we drill public mental health into the DNA of oneself or the organization? Yes, definitely. And I believe it is must for anyone or any organization. Some of the benefits one can reap by incorporating the genes of public health are: it helps in outreach as well as reaching the masses. It helps in reduction of stigma and enhancing awareness. This in turn can lead to early treatment and more supportive environment for one to recover. All these ensure the mental health care provided are universal, effective, and reach larger populations. With evolving technologies and healthcare, a constantly evolving and effective public mental health approach is the key to future mental health and well-being of the community. So be a public mental health champion and take the next step. If you are interested to check out about some of the public health initiatives and various activities of our organization in the area of mental health, feel free to go to any one of the links mentioned here. It was great to have interacted with you. Let's leave behind world a better place. Thank you very much.